So let's talk about first aid for splinters and small cuts, because first aid is not just about dealing with the serious accidents and injuries that can occur. We also need to be able to deal with some of the minor things. Now with a small cut, such as like a paper cut or a small graze where someone's fallen over, what you need to do is calm the casualty down if needed, and you need to be able to clean the wound, either by running under a tap or using a wipe and just gently cleaning it. Now if it's got dirt in there, please don't use a wipe. It's like sandpaper on somebody. Just wash it underneath the tap. When it's clean, you just need to protect it and need to cover it. And ideally, a suitable dressing would be a plaster. Just make sure though, when you hand somebody a plaster or when you're about to administer a plaster, you check they're not allergic to it. And if they are, please don't use it. Now generally speaking, these will normally heal themselves, but it's worth keeping an eye on it to make sure it doesn't get infected. Scratches. Now small scratches don't really need anything doing to them. This may be just a scratch as you go past a bush, a thorn or a hedge bush. But it's worth just looking at it to make sure there's no dirt in it. Clean it if needed, with one of those wipes or water, and then maybe consider using a plaster. Blisters. Now blisters can happen in any workplace. It might be you're doing work with a hammer a lot or power tools, and that can cause a regular blister. It might be because you are playing sport in new football boots. That can cause a blister. I know I've had them when I've been training for the marathon. Now if someone has a blister, then you need to keep the area nice and clean, and you've got to try and keep it as dry as possible. And cover the blister with a plaster to reduce the cause of the friction. The important thing with blisters though is please don't burst it. Because if you do burst it, then there's going to be a lot more chance of it getting infected. Just leave the blister as a blister, because what the blister is doing is actually protecting the skin underneath. So if you burst it, you're then exposing that skin, which can get infected. Splinters. Now splinters can enter the body in many different ways. Common splinters tend to be from wood and maybe small pieces of metal. Small splinters can be very hard to see, and if you cannot remove it, then it will usually work its way out in a few days. If, however, you can see it and there's a clear head to it, it's not underneath the skin, there's a clear head to it, then you can remove it with tweezers. The first thing we do though, let's just say it's in the finger, is to clean the area with a mild soap and water so that the area is nice and clean, and then there's less chance of dirt entering the body through the cut that the splinter made. So always clean it. And where you can see the end of the splinter, carefully grip it with the tweezers and put it out in the direction that it entered the actual body to avoid breaking it in half. After you've removed the splinter, it's normally a good idea to squeeze either side of the wound. So just kind of squeeze either side of the wound to allow it to bleed, which can flush out any dirt if there's anything in there. And then you can cover it with a plaster if need be to prevent it from getting infected. And of course, you'd always seek medical advice if you can't remove it or it's bleeding heavily or maybe it's in a sensitive area such as under a nail. Don't forget to hit that subscribe button so you don't miss out on any of our important videos.